National Hospital Insurance Fund and the Association of Insurers are adamant that it is impossible to give COVID-19 patients a comprehensive health cover. During a virtual session with the Senate Committee on Health, the public and private insurers called for additional funding and subsidies to meet the rising need for insurance amidst the surging pandemic. Health CS Mutahi Kagwe announcing that NHIF will be reformed as the ministry seeks additional funding through Parliament. Here now is Elfa Slagat with the details.
For the second day running, the Senate Health Committee sought to find out why NHIF and private insurers are hesitant and even stopping to pay claims for COVID-19 related treatment.
I've listened to the presentation also by the CEO. And the CEO appeared before us yesterday. And what I'm getting is that you won't pay, you can't pay.
NHIF CEO Peter Kamunyo defending NHIF's move to stop covering patients diagnosed with COVID-19, insisting treatment costs, inclusive of personal protective equipment for medical workers attending to COVID-19 patients, would make costs for handling patients expensive and out of reach. Senators, among them Ledama Olekina, Michael Mbito, Beth Mugo and Aaron Chiriot, all criticized NHIF's resolve and that of private insurance companies who insisted they have no capacity to cover surging cases, especially for COVID-19 patients in need of lengthy and critical care.
Can't pay, won't pay is not an option that is acceptable to anyone, but we must meet each other midway, understanding the dynamics of a business, what you need to do to survive as well, but also balance that with the needs of Kenyans, the various people that are facing these challenges.
Insurances do have some money, extra monies, and isn't this the time, such a time, when maybe you can now give back to your clients, especially those lower income ones who have no any other way to pay?
Private insurers told the Health Committee that they have provided stopgap measures to partly address the resurgence of the virus. Tom Gichuhi, the Executive Director of Association of Insurers, saying the association has identified 24 fairly affordable Tier 2 hospitals which will continue to pay for COVID-19 related treatment.
24 in number for treatment, and we shall meet all the cost for the treatment because we have already signed contracts with those hospitals. The total exposure in terms of money is 502 million. And out of the 250 million, out of the 502 million, 230 million has already been paid.
Health Cabinet Secretary Mutahi Kagwe has announced that NHIF will go through a reform process so that Parliament can grant additional funds so that the National Health Insurer can cover COVID-19 related treatment.
We have got reforms coming up at NHIF. It is the only way that we can be able to give UHC. And what we are going to do is we are going to work with Parliament so that Parliament can give additional funding for NHIF so that we can cover even COVID cases.
For now, it appears that patients, especially those in need of critical care, will bear the brunt of costly medical bills, with numerous calls for government to take decisive action to cushion Kenyans in the face of the ravaging pandemic. Elfa Slagat, Citizen TV, Nairobi.